So we're here today to talk to you all about how doulas can be involved with smooth transitions. Next slide, please. So before we really get into the program, I think it's helpful for folks to have a little bit of a national context. What we're seeing, and this may not be new to you, nationally, the rate of community birth is on the rise, and we like to look at a recent CDC report between 2019 and 2020. They showed that there was almost a 20% increase in community birth. Some of this was likely due to COVID, with families choosing to give birth in settings where they would be less likely exposed to the virus and where there were no restrictive policies for the number of people who could be present at their births. But notably, the greatest increase was found among Black birthing people. And I think that's also not a surprise because of what you see in the media about higher rates of maternal and newborn mortality among that group. Also, in April of 2022, the National Partnership for Women and Families released a policy report noting that expanding access to care in community birth settings is a cost-effective solution to providing higher quality care and better birth outcomes, and to advance birth equity. And so as we see community midwifery care increasing throughout the country, there's also been this growing need to ensure safe transfer of care to the hospital when that higher level of care is needed. Next slide. Therefore, smooth transitions, because this is really our space. So Smooth Transitions is a Washington-based organization housed within the Foundation for Healthcare Quality, which is a neutral 501c3 entity that holds several other quality improvement programs. It was launched in 2009 under the Washington State Perinatal Collaborative, and has grown widely across the state with around 24 hospitals participating in the program. And while there has been a long-standing support between Smooth Transitions and other states that are interested in our quality improvement model, our organization has really begun more intensive collaborations outside of Washington in the past years with this national interest. So here are the program's mission and goals. The mission to address our shared responsibility for improving hospital transfers from planned community-based births to promote greater patient safety and satisfaction. We want to make sure that when we talk about this shared responsibility, we really mean it. We're equally committed to engaging hospital personnel, community midwives, doulas, and EMS providers in these conversations about best practices regarding transfers. There's a lot of work to do. Now, looking at our goals, the first one is to improve whole person safety and efficiency of the transfer process through the establishment of system-wide guidelines. And we recently changed whole person safety to encompass emotional, psychological, social, cultural, spiritual, and physical processes and outcomes. So we really expanded that. Our second goal is to collect and analyze transfer outcome data for the purpose of quality improvement. Third is to build greater collaboration between community-based midwives, doulas, EMS, and the hospital care team. And lastly, to enhance the patient experience of care when a transfer occurs. Next slide, please. Whoops.
Okay, sorry about that. So shifting our focus, I want to talk a little bit about the program components. So what we've found is that our entire QI cycle is really essential to making the program successful. So each one of these basic components has an important role in improving transfers. So we start with an initial hospital presentation. We work to co-create transfer guidelines for that facility. Then we begin holding perinatal transfer committee meetings, which I'll talk about shortly. We have a qualitative data collection survey platform that we're collecting qualitative data from 360-degree view, so all parties involved in a transfer, and then we are, just working to creatively problem solve to improve the quality of care and patient experience. This is a screenshot from the Smooth Transitions website. where on the participating facilities page, we have a couple of different dashboards, and this is one of them, and it has information, and it's kind of ever changing as that environment or that landscape is ever changing. But there's data here about community birth by county, as well as information about particular hospitals and facilities. So the ones shaded in blue, the crosses that are shaded in blue, indicate that those are Smooth Transitions participating facilities. So as I talked about, these surveys, the Smooth Transitions Transfer surveys, are really an essential part of our work as they help us to gather information about what's going well, as well as areas for improvement at each of the facilities or within the community. So surveys can be completed for transfers to any area hospital. This anonymous data is reviewed at the quarterly meetings at each participating facility. They are qualitative in nature, and they allow for really honest and specific feedback about the transfer experience. So doulas are encouraged to complete surveys on all transfers, whether the experience was good or not so good. And as doulas are really encouraged to also discuss these surveys with their clients at postpartum visits so that their clients can be encouraged to fill out a transfer survey as well. And as a note, there is a $25 gift card incentive that's offered to all clients completing those surveys, and the information about that is on the survey itself. Posters and business cards are available also with the QR codes that link to the surveys. So on the right-hand side of this slide, you see the link to the survey page on the Smooth Transitions website, as well as a QR code that can take people there. And this is a screenshot of that survey page. So there you can find all of the different surveys, but relevant to you all would be the doula survey and then directing the midwife client survey for your clients. So just a bit here about PTC meetings, that stands for Perinatal Transfer Committee. These are meetings that they're typically quarterly, though some facilities have a different cadence to them. They're held virtually or in a hybrid way, but there's always a virtual option. We do introductions at them. We give time for practice updates from the hospital, as well as from community midwife practices and doulas if they are present. We discuss those survey results that I talked to you about. They're de-identified and anonymized. And then we really just work on areas where improvement is needed, so that creative problem solving. And we really welcome doulas at these meetings. It's a great opportunity for relationship building and for your voices to be heard. And this is a screenshot here of our calendar that's on the Smooth Transition website. This is where you could go to find the different perinatal transfer committee meetings for each participating facility if they are doing them. This is updated often. Sometimes things can be a little bit wonky with facilities if they change kind of last minute their dates and times. But please feel free to reach out to me at any point if you have questions about a PTC meeting and in terms of like date, time, meeting link or anything like that. And we'll have all of that information at the end of the slideshow. And with that, I'll hand it to you, Mariah.
Yeah. As Melissa mentioned, the goal of Team Birth is to be implemented at every hospital in Washington. At the heart of it, Team Birth supports open communication among patients, their support people, and clinicians during birth. Through structured huddles or group communication gatherings, utilizing a shared planning board, the hope is that it empowers everybody to reach decisions together. The result is more dignified, respectful care that gives patients the role that they want to be centered. Next. The team birth approach lies not only in centering what the family has shared in a shared decision model, but rather has all participants focus on a cohesive whole family approach to care. From the time a patient is admitted to labor and delivery until they are discharged after birth, participating hospitals will join their care team and the family in those shared communication huddles. Hopefully the team will discuss what the progress is, what changes to care need to happen, as well as giving everybody an idea of like what is the next time that check-in and the decision point might be. Every person on the team is invited to participate in that and share their experiences and perspective. When those huddles happen, the team will take notes on that communication board. Many of our hospitals have those whiteboards, and it's just a matter of making sure that that information gets up there so that everybody knows what's going on. Hopefully everybody has shared their name and provide a visual reminder of the plan and preferences for this family and the baby. Team Birth is currently testing tools for use in prenatal care and during NICU stays to also improve teamwork and communication across the continuum of care. Next. Team Birth has provided some really amazing resources outlining how these programs work, and these are available on the website for download. As we mentioned, like that link will be provided in the chat. It does change and update because we realize this is an organic process that does change based on feedback. So check back frequently. Next. This is the current handout that lives on the website, and it is available for, saving on your phone, downloading it. It gives you a really good idea as a doula about like what is Team Birth, what are the specific ways that your participation is going to be used to help increase that whole family approach to care. But also gives you some really good ideas of like what you can expect as a member of the team, how to participate. It is an open invitation to add yourself to that board as a member, as well as just some simple tools for how to get involved with it.
Yeah. So as you all know, doulas are an essential part of the labor team across any birth setting, and really proven to improve outcomes. Often doulas are one part of the care team that will remain constant across a transfer experience. And because of this, that insight that you all have into transfer is essential to our work. So as we begin to establish the program in more and more hospitals and locations, we really hope to bring doulas in to the program, invite you to the PTC meetings, amplify your voices, and advocate for your clients' needs. So in summary, as far as your role with smooth transitions, here they're listed out. We've talked about them. Complete a doula survey following a transfer of care. It won't take long. It's probably less than 5 minutes or about that. And encourage your clients to complete a survey too. Like Sarah said, that's a $25 value client incentive that they'll receive. Join in the perinatal transfer committee meetings at hospitals that you're actively working with, and step up, participate in these Team Birth huddles. I think that's going to be a valuable place for your voice. Next slide, please, Sarah. In closing, we did put all of our contact information, our emails here. If you all have questions about smooth transitions, probably the first place to go would be to email Sarah. I'm also going to put the link to the website in the chat here. qualityhealth.org/smooth transitions. And from that website, you'll be able to navigate all the things we talked about. So the participating hospitals, and on that, there's a spreadsheet or a kind of a chart on that page, which lists transfer documents so you can access them yourself. Surveys, the survey page, the calendar page, and we have on our resource page a whole kind of side section on Team Birth and all those materials that Mariah talked about, that guide, the list of hospitals. They're implementing Team Birth in waves throughout Washington. So I think that might be helpful for you all to know. But in general, thank you very much. And we hope that if this was useful, please share it with others in the doula community.